Hi, I'm Dr. Brenda Dintiman of DermUtopia Wellness, and today we're going to talk about glow up while you slim down, all things about Ozempic and Wegovy and skin. And today I have Dr. Sodhi from Monarch Wellness. Welcome.
Thank you so much for having me. I'm excited to have this conversation with you today.
That's great. We've been seeing so many patients that have tried so many things: keto, fasting, cardio, calorie counting, intermittent fasting. Why do these strategies stop working? And what is your view on all of this?
So it's multifactorial, but it is complicated, and that's why a lot of patients get very frustrated. So when you think about putting yourself on any type of restrictive diet, whether it's keto, paleo, intermittent fasting, whatever it is, if you lose weight, you have to keep doing that thing that made you lose weight essentially forever, because we have something called the set point in our brain, and that's where our weight sits. So if you stop doing the thing that you did to get to the weight that you wanted to be, you're probably going to gain the weight back, because your set point, it's basically like the thermostat for your brain. It's going to remember what weight your brain wants you to be at. Just like your thermostat in your house wants it to be maybe 70 degrees all the time. It works the same way. And so there are biological mechanisms that will pull your weight back to that set point, regardless of how much effort you put in. And that can be really frustrating. So that's one of the main reasons why people, have a hard time maintaining their weight after losing some with those various diets that you mentioned.
And how do the GLP-1s really work? We hear so many things, but I really want to hear how you tell your patients how they work.
Right. So I do say they're probably as close to a miracle drug as we have in our lifetime. When you think about that set point weight, there are three things that go into it. So you have your environment, which is what you're eating, how you're moving, your stress, your sleep. You have your genetics, which as of right now we can't change. And then you have your hormones, right? And that's what GLP is. It's one of the many hormones that affect your appetite and your weight. It works all over your body. It's not just working on, one weight loss center in the brain or in the gut. It's working in all different places. And that's why it's being studied for so many different reasons. Now, the GLPs essentially work by reducing your appetite, reducing your cravings, and increasing your fullness, which we call satiety. So a smaller amount of food would make you feel more full. And that basically your stomach would send a signal to your brain saying, we're done. We don't need to continue to eat more. And so some people naturally have less GLP. Right now, we're not directly measuring that, but that people say that when they're on the GLP drug, they feel normal. They feel like they're not distracted by food. They're not thinking like, what am I going to eat, where, when? All that food noise, that volume of that food noise is turned down. And so that's how they work. And we actually don't know the extent to which they work and the mechanisms that they work by. This is what we know now, but we are uncovering more and more details about the mechanisms of GLP. So it is a very exciting drug class, and it works really well. There's a very few amount of non-responders. I think the data shows something like 10 to 15% of people don't respond. In my clinical practice, I find it to be far less than that. I think most people do tend to respond pretty well.
Yes, I'm seeing so many great results in my practice and kind of following them along their journey and trying to observe, because one of the biggest questions we get is, should I just wait to think about my skin or
Yeah.
worry about my lines or how my skin is and volume in my face is changing until the end?
Yeah.
And my answer is no.
You,
I want them to love
yeah.
themselves along the way.
Yeah.
Like you do losing weight. You don't wait till the very end to put on that cute outfit or to,
Exactly.
try to feel good about it. And so I don't know, is that your impression too, that they should be loving their skin along the
Yeah.
way and their body?
Totally, 100%. Just like you said, with buying a new outfit, you shouldn't wait until you're at a certain weight to buy the outfit you've always dreamed of. I mean, it'll boost your confidence, right? Same with glowing from the inside out. That's a massive confidence boost. So I would say the more self-care you do, the better, and taking care of yourself, because weight and metabolic health is just one piece of that larger puzzle of self-care.
Yes, and I just see that their skin looks less
Yeah.
inflamed, and then you also see their inner happiness, that they see that they're making progress. But I do have a lot of patients that are still so worried about the side effects. What are the side effects that you see your patients worry about? And we can talk about what we see in the skin
Yeah,
too.
absolutely. So for the most part, they're pretty well tolerated, the GLPs. But if someone is going to get a side effect, it's typically related to the fact that it is increasing your fullness. And so it's kind of slowing the whole gut down. If you think of it as plumbing system, we're backing everything up a little bit. And so that can start with some constipation, right? It can result in some acid reflux or some nausea. So if someone is going to have a side effect, it's usually a gastrointestinal one like that. Some people will get a little bit of a fatigue or a headache. Usually that has more to do with hydration and not eating enough. So I always encourage them to keep a food log and talk to your doctor about if you're on the right dose for you. There is a bit of an art to that, right? Not everybody should be at the highest dose. So I think that a lot of the side effects can be pretty dose dependent. So you don't want to be on too much. What are some of the side effects that you're observing?
Well, I don't see that
Okay,
much, except that, like I said, people will have to sometimes back off on their dose. Maybe they're literally having no food chatter, which I don't like seeing with respect to the skin and their health in general. I love when I see the doctor working with the patient and kind of helping them lose the weight a little bit more
right.
slowly. I think skin and the volume in your face and in your arms and your legs has time to kind of catch
Yeah,
up. And then, of course, we do see people that seem to almost hit a critical point, and you do see that Ozempic face, they
yeah,
call it, just the extreme hollowing, which we see with anybody who's had a lot of weight
exactly.
loss, whether it's from a thyroid condition or sadly chemotherapy and weight loss from cancer. So I don't think patients like that, but I feel like the majority, I'm not seeing that. And we have ways to help that by using not necessarily filler along the way, but a lot of times hyperdilute radiesse, and some use Sculptra to make your own like thin stimulation of your own collagen. And that's been very helpful. The other problems we see are hair loss, and that's probably the most common one. But I see that even if people just lose 10
Yeah.
pounds, for other reasons, long before GLP
Yes.
1s. But I think we really need to. What do you do? I think they need the protein support for
Yeah,
sure.
100%. That's what we talk about. And slower weight loss. And in general, slower weight loss is ideal. We can't always achieve that, but it is ideal. But it is something natural, right? That we go through anytime we lose weight. And so I tell my patients that this is something that may happen to you, but the slower we can lose the weight, the less you'll feel it. It won't hit you quite as hard. But yeah, emphasizing a well-balanced diet. If you are not able to take in all of the nutrients that you need, maybe a multivitamin to supplement your diet could be helpful. And then making sure you're getting enough protein, which can look a little different from person to person. But basically, you want to make sure that you're eating in general, because if you're taking these medications without being monitored or really keeping track, you could eat too little, and too little to support your body and the regular processes that happen to make our hair and to make different functions work. So it is very important to pay attention to your specific dietary needs.
I agree. And you'll see pretty intense thinning here and shedding, and it can happen often 3 months after the process has started. So patients will get very
Right.
anxious. And as a dermatologist, we will check the scalp, see if there's any other conditions, but can offer a lot of reassurance because if the scalp looks healthy, there's no scarring, redness, inflammation, you will grow hair back. It
Yeah.
just takes
Yeah.
time. And I think that's where there can be a lot of anxiety that they've traded one problem for another. But I don't think so. It's our body changing, it's
Yeah.
adjusting. Concern I see also is some crepiness of the skin that develops. And that can be a little bit challenging to
Right.
help patients with. Surprisingly, there's an over the counter product called Dermend that can help that crepey appearance. I mean, it just has to be applied twice a day,
Okay.
kind of has secret ingredients in it, but little tips like that, I think, are helpful for your
Yeah,
patients.
definitely.
And then it's helpful for me to work with weight loss experts because I want to be able to ask, are you losing your weight maybe a little too quickly? Are you really
Yeah.
following what they say about the
Yeah.
protein? And what about muscle mass
Right,
loss?
right, totally. And I do want to get the name of that product at the end, if you don't mind sharing for all of our listeners. That's excellent. So when we think about muscle loss, some is to be expected if we're not being extremely intentional about stimulating the muscle. So the way that we grow muscle is by stimulating it. It's probably more important than all the protein. We talk about protein a lot because we're obesity medicine doctors in the lifestyle space, but really to grow muscle, you need to stimulate it. And so if you don't have a plan to stimulate it, and what I mean by that is lift some weights or do something that is challenging for you, which will look different for the next person, right? So for me, it might be lifting an 8 pound dumbbell. For the next person, it might be 15 pounds. But the point is, you want to stimulate that muscle to grow it. And that takes time and effort and energy. And so if we're not really doing that much, meaning 2 to 3 times a week, we probably will lose muscle. And that's okay, because a lot of people, just let's say we weigh 300, 400 pounds. To carry that amount of weight on your body requires muscle, right? So in effect, you are exercising by carrying that load every day. And so you may be what we call over muscled. You may have more muscle than you need, but you also have more body fat than you need. And so when we're losing weight, you may lose a little bit of muscle and a little bit of fat. The idea is to make it so that you lose more fat than muscle and cut your losses, essentially. So I always look at, okay, well, we've lost this many pounds of fat versus this many pounds of muscle. And if we can minimize that muscle loss, we're in a great place. Now, if you go into taking a GLP medication without a dedicated strength training plan, you're probably going to lose a bit more muscle. And again, it depends on each individual. So if your starting weight or body habitus is elevated, 300, 400 pounds, of course, you're going to lose some muscle along the way. But if you are what I call doing a body recomposition, and maybe you're in, like, your BMI is 30, or you weigh, it depends on your height, but let's say you weigh 180 pounds, we're kind of fine tuning things. And we do want to focus a lot more on reduction of the fat and increasing the muscle.
It's interesting. Yeah, I hadn't thought about that you may be 300 pounds, but you also have a lot of muscle that's
They
having to sustain.
definitely do. They can afford to lose some muscle, but that doesn't mean we don't stimulate it. That doesn't mean we don't still make efforts to get stronger and make sure that our posture is correct and that we can carry a body at a lower weight. We still want appropriate amounts of muscle, and we have to stimulate it to maintain it properly.
And I know in your practice, just like in mine, I'm seeing so many people that are perimenopausal and going through menopause that are also on GLP-1. So we're also like delving into that whole
Yeah.
world of, helping them through that process. Many of the patients, as you know, are on now estrogen patches, progesterone at night to help sleep, which I think is also helping that whole food craving and
Hmm.
erratic patterns that maybe we develop when we're so busy raising teenagers, going through menopause, trying to keep it all together. And the last person you worry about is you.
Absolutely.
And what I also know is, as a dermatologist, we can help them because they may develop some acne just naturally through menopause. And then I've had a few patients develop some nice extra fuzz, almost like
Okay.
vellus hair, and their hormones need to be adjusted. But I think we're in that very interesting space where we're going to be able to not just tell patients, oh, you're just going to gain weight
Right.
through menopause.
Right.
You have to live through.
Absolutely. I think that was definitely very commonly told to women over the past couple of decades. And menopause was almost just this rite of passage. And you just, there was nothing to do about it. It was like, sorry, you're just going through menopause. But the weight gain can be very real and can be a major setback for a lot of women. And I think that a lot of the treatments that are available now with hormone replacement therapy are very complementary to what we're doing in obesity medicine. When we enter menopause, your estrogen drops off, right? And so that can make it harder to maintain that muscle mass. So what I'm telling my younger patients that are maybe in their early 30s to late 30s is, hey, go into menopause as muscled as you possibly can, because then you can afford to lose a little bit and you're appropriately muscled going in there, because muscle is so important for all of that, right? Weight strength training has a positive impact on things like prevention of osteoporosis. So it's hard to be over muscled intentionally. So, I always say that don't underestimate the benefits of strength training, especially in that perimenopausal period.
Yeah, and I think I'm seeing like the two extremes. I'm seeing very, like 38, 40, 45-year-olds going into menopause and on GLP-1s. And then I see, of course, a lot of people 60, 65. And, they kind of feel like I did, like we were kind of left out,
Absolutely.
and having to navigate, what's the safety profile? Is it okay for us to be on hormones? How do we start? I think we're going to learn more as
Yeah,
more and more people are on hormones. The initial thoughts are that no, they don't cause acne or they don't do this, but we all know that in an individual, you may need a different dose
exactly.
than your friend down the street. And so you need someone that's trained, that's going to work with you, just like you do in weight loss. We know we can get these medicines in ways that are maybe somewhat unmonitored. I really recommend that we take these medicines
Yeah,
seriously and take the person's individual needs seriously.
absolutely. I think it's the whole person, and the hormone therapy definitely has a role in terms of overall well-being and making a person feel good. And like, why should you suffer at night with hot flashes or have mood swings and irritability and all of this when we have treatment for it now and it's evidence based? I think that's the beauty of it, is that nowadays we're questioning what traditional medical school has taught us, which is that don't come near a woman with hormone replacement therapy. You don't want to kill her. And so that's what I was taught over 10 years ago when I was in medical school. So there's, I think, as Dr. Rachel Rubin mentions, there's a whole generation of doctors that were not trained properly to treat menopause. But there are a lot of doctors like yourself and me that have actually stepped out of our comfort zone to learn how to treat menopause and how to administer hormone replacement therapy. So I think there's a lot of us that understand the value, and that there are so many women that are asking for this treatment and don't want to suffer.
Yes, and as you know, that I saw the transition between everyone was on hormones to everyone was told to stop
Yeah,
them from day to one day to the next, and then saw people who stayed on them
really.
anyway. And later, I've had three patients come in, and just ironically, both 70 to 74 years old, and I had to take a double take. And of course, these are
Yeah.
vignettes, but their skin did look better.
Okay.
They did look like they had aged differently than their
Interesting.
friends. And you wonder what components that was. I think some of it may be almost an anti-inflammatory
Yeah.
component, things we didn't talk about. So that's really super interesting. You can't turn back time. You can only turn back so much, but we all know
Yeah.
sunscreen and the things we do, and we just try to be super encouraging to our patients, because to teach them to love the skin, love the body you're in, and start now. You can't go back and say, I wish I'd done this. I wish we'd had hormones, but we can start now and see how our body can react and adjust. And, our inner feeling about ourselves also makes us look and feel better and affects the actions we take day to
Yeah,
day.
definitely. I think that inner work never stops. And certainly,
Never.
if you lose weight, you could go from a size 10 to a size 6 to a size 4. And your brain, if your brain is still kind of critical of yourself and you're sabotaging and you're thinking, I should have done this, I wish I did that, I wish I looked like this, but how come I don't look like her or him? That's not helpful, and that's actually detrimental to your long-term health, right? That's that chronic stress of not being good enough. And so we definitely need to work on that. That's something that I talk to my patients about a lot, is that you're here right now. Let's move forward. Let's not look back. Let's just move forward and get the most gains that we can get at this point. And you are as you should be, right? You are complete, and we have to talk about that, and instill that in our patients. And I have daughters, so we talk about this a lot at home.
I was just going to say, at every age, we can show our daughters, our sons, to try to love themselves the way they are, and that new research will come out, new ways will come, and they need to learn and adjust
That's it.
and live
Be
a new life.
flexible. Yeah.
What are the three recaps you want people to take away from this so that they
Yeah,
remember?
definitely. I would say number one is work with a dedicated doctor or other provider on your weight loss goals. If you're going to do a GLP medication, it is so important that you're medically monitored during this process, especially at the beginning. Like we've been talking about so much today, we don't want to lose muscle if we can help it. We want to minimize that. And so working with a doctor who specializes in the treatment of obesity is very important. Number two would be, like we just said, work on your inner talk. How do you talk to yourself? If you're having issues with that, there are resources to help you, work through that dialogue with yourself, whether it's therapy, your primary care doctor, friends, social, we want to make sure that we're looking at that the way that we talk to ourselves. And number three would be, be patient, because sometimes, like we talked about, weight loss can feel slow, but keep doing the work. The power is definitely in consistency and not in perfection. And so sometimes we encounter a plateau. Sometimes we gain weight, but maybe that weight is muscle. So it's just, the advice would be just keep going, just keep powering forward, and know that every rep you put in, quite literally, is a step forward. So those would be my top three recommendations. Thank you so much.
Yeah, and I think it's true with the skin. We know that consistency is what makes a difference. You're not going to find one product that's going to just turn your skin around. I really don't recommend people coming in and just having everything done in one day. I'd like to see them do a little at a time. If you do one syringe of hyperdilute to stimulate collagen, come back in a couple
Mhm.
months. Work on the texture and the pigmentation, maybe other things you've let go over time because you have not been taking care of yourself. So it's time that you can do it, but you don't have to do it all at once. I think it can be overwhelming
Yes,
to make too many changes at once. So it's so great to talk to you. Where can they find you? Where are you, and where can we find you if patients want to reach out to you?
absolutely. So I see patients in Arizona and Pennsylvania. I do have an office in Arizona and Scottsdale. And you can find me at monarchconciergewellness.com or Instagram at Dr. Mona Sodhi.
That's great. We'll put all the links also so people can reach out to you. Thank you so
Yeah.
much and have a wonderful
Yeah. Thanks for
day.
having me.